Hey guys.
Hey guys.
Hey people.
Hey people.
Hey people, so today we're gonna see about an important muscle. So I'll just give a short introduction about the muscle. Muscle is finger-shaped structure. Okay, just hidden under the two muscles, pectoralis major and the latissimus dorsi. So the muscle is used for punching movement. So everyone could have find it in serratus anterior. So this is a muscle which gives a lot of referred pains, which we have been confused a lot about physiological symptoms because of this pain. So when we talk about that, the origin of the muscle is from first to 8th or 9th reps. That's the answer. Origin, insertional, it go under beneath your subscapularis and then lat, and then attached to the medial border of your scapula. So the movement of this muscle is, there are three main movements. First is for upward rotation of the scapula. Second one is protraction of the scapula. Third one is it will assist for your shoulder elevation. So it's a beautiful thing about this muscle. Without this muscle, you can't do the full shoulder elevation movement. Either it could be flexion, it could be abduction and extension. So basically, your scapula needs to be raised. It go for upward rotation, so it will allow the more room to do the movement. So this is the main function of your serratus anterior, doing upward rotation of the scapula. Because of that, the full shoulder flexion elevation will happen. So when we come to the pain part, the referred pain will be near your chest, this region. Breast tenderness will be there, and next is on posterior side, lower end of the medial border of the scapula. That's where the pain is, a main pain. And then to your inner side of your arm till the pinky finger. So these are the referred pain patterns. It could resemble a symptom for chest pain also, like heart attack also. So this is the referred pain, main referred pains for it. And then cause for the serratus anterior tightness or weakness. The first cause is an undertrained person who is overtraining it or overtaxing the muscle. So you can tell functionality like sprinting, running, and do this movement. An athlete, they won't get a maximum pain over there. When we are running after a long time, we'll get a catch or some sharp pain, stabbing pain below our chest region, below our rib region. This is also one symptom, or we can say a pain because of your serratus anterior. So about breathing, this contributes a lot in breathing. So for breathing, it will allow room to do an expansion of your chest. So it will allow more air to go inside for a lower chest region. So when it comes to it, if the muscle is in trouble, if serratus anterior is in trouble, there are two muscles which will overcompensate it. The two major muscles are sternocleidomastoid and then the scalenus. So these two muscles will overcompensate. Because of that, what happened? There will be forced breathing. You can't do a deep inspiration and then full expiration. That's it. You can't able to do full inspiration because of that muscle tightness or weakness, you can tell. So this is about the main function and role of serratus anterior. And we all know boxer's muscle, punching movement. That's what we do. So that's the main purpose. We want to activate serratus anterior. That's why we'll do scapular push-ups, push-up plus, and then your scapular pull-ups. Okay. When it comes to the functional activities which could affect us, swimming, running, overall activities, any kind of sports, overdo will affect it. So this is about the brief introduction of serratus anterior muscle, how you can palpate and release, So you can ask them to lie, face up lying. So to palpate it, ask them to do 90-degree elevation of your shoulder, then ask them to punch. So there's a muscle which will pop over here. It's a very small part which will be visible because it's partially, you can say it, maximum it's under pectoralis major and the subscapularis, and then where lat will cover it, but the minimal part will be shown. So that's how you can figure it out. So the main palpation movement you can do is you can ask them to punch, and then the muscle will pop up over here, exactly below your armpit or your axilla. So this is the muscle, serratus anterior. For most people, they won't have pain if they do the regular movement and everything. If the client is having a pain, they either they do a overdo movement, because of that they'll get a pain. So as we know, we'll do in a perpendicular direction. It's a longitudinal way, we'll do in a perpendicular direction. So the muscle will lie like this. Okay, it's a finger-shaped structure. It will go like this. So you'll do in this direction. In this, you can't specifically say the spell as we see in upper trapezius and lat and everything. You can't pinpoint that one point there'll be more pain. So the pain could be in whole muscle also. So you should have to palpate whole the ribs, all over the lips, and then find out where the exact trigger point is. Trigger point, how we can find out? Because of pain, that's it. So relax, and then you just move it. Pain will come. So you have to find out where the pain is by just touching, and then you can tell and you can release it. So this is about serratus, and it's a very small muscle, it's a very easy muscle to palpate also. And then there's no need of more pressure to it because it's more superficial muscle. So this is all about serratus anterior. Any doubts or anything?
Is it very common, like the intra-titan